If this study makes you uncomfortable, that's probably the point. Because one of the quiet takeaways here is that spinal manipulation may be more of a clinician-biased need than a patient-biased one. In this trial, patients with acute and subacute low back pain, specifically those at moderate to high risk of becoming chronic, per the StartBack tool, did just as well and sometimes better when clinicians focused on supported biopsychosocial self-management. No mandatory manipulation, no must-add manual therapy, just tools, context, and support. And for a lot of clinicians, that's confronting. If you talked to me 15 years ago, this probably would have definitely triggered me. Because if you're like me back then, you've invested years, financially, emotionally, professionally, into the belief that manipulation and manual therapy is essential. This kind of data can feel threatening. And that's not bad science. That's the sunk cost fallacy showing up in healthcare. The study doesn't say manipulation never helps. It says it's often not necessary for good outcomes. Patients benefited when we helped them regulate stress, move with confidence, understand pain, and engage in their lives again. So the question isn't, where do I fit my technique in? The question is, what does this patient actually need to recover? Modern pain care isn't about protecting our identities as clinicians. It's about creating conditions where patients don't need us forever. And sometimes that means letting go of interventions that serve us more than they serve them.